for coming in. Hi, everyone. Hello. 15 people incoming. Hi, everybody. Hello, everyone. Hi, Clarita. Hello, Vladimir. Ludmila. Good afternoon, everyone. We have 35 so far. Hi, Faina, Vina. Hi, Maya and Mobasam. Hi, Bridget. I can see you're raising your hand again. If you have any questions later, Bridget, you can use the chat box or the Q&A question, Q&A box, okay? Hello, Gaida. It's 3 o'clock. Good afternoon, everyone, and welcome to the Senior Immigrant Safety Expo, hosted by A&O Support Services for Older Adults with funding from New Horizons for Seniors program. And I just want to acknowledge the land where we are hosting this event. In the spirit of reconciliation, we acknowledge that Manitoba is the traditional land of the Cree, Ojibwe, Ojibwe, Dakota, and Dene people, and the homeland of the Métis Nation, and we are on Treaty 1 territory. Welcome to our presentation about healthy aging, and we are lucky to have two presenters with us today. I'm going to start to introduce Taylor. Taylor is a registered social worker here in Manitoba, and she's been working with the Winnipeg Regional Health Authority, or WRHA, in the downtown and Point Douglas area for the last 2 years. She's providing support to individuals navigating and accessing systems and resources. In her current role as WRHA Healthy Aging Resource Team Facilitator, Taylor has the opportunity to work with older adults 55 plus in the community, find resources, maintain and improve their health, provide information about health services, and to help people learn about healthy living. Taylor likes to spend her free time outdoors, in the gym, or in the soccer field. Thanks for being with us this afternoon, Taylor. And our second speaker is Kathy. Kathy is a registered nurse in Manitoba, where she has focused the majority of her career supporting older adults in various health settings. Kathy's current work as a community facilitator for the Healthy Aging Resource Team in Winnipeg provides an opportunity to support older adults by coordinating various health and social services with the overall goal of stronger, healthier people and connected communities. Welcome, Kathy, and thanks also for being with us this afternoon. Before we start, I just want to remind everyone that if you have any questions, you can use your chat box or your Q&A box, and we will read your questions later. We have about 10 minutes to check and answer your questions. And at the end of the presentation, we will pick 3 winners of our gift card prizes. Okay. So I'll give the floor to Taylor and Kathy.
Perfect, thank you. Let me just go ahead and I'm going to share my screen right away. Let's see here. Okay. Can everybody see that okay? Perfect. Okay, I may lose you guys, but that's okay. Just a second here. Okay. So yes, we are the Healthy Aging Resource Team, and we work in the downtown Point Douglas team. I am a registered social worker, as Lorena had mentioned, and Kathy is a nurse. And so what we're going to talk about today is a little bit about the HART program, the services and supports we provide, as well as a little bit about healthy aging. Okay, so the Healthy Aging Resource teams, there's 3 of our teams in Winnipeg, and each team consists of different professionals, such as a nurse, occupational therapist, social work, or dietitians. Together, we provide health services and community support for older adults living in 3 different areas of the city. So we work with different community agencies and programs to support older adults to remain living independently in the community as long as possible. So the 3 teams would be downtown and Point Douglas, with myself as a social worker, Kathy as a nurse. There's one in River East, Transcona area, where there's an occupational therapist and a registered dietitian. And we've got one at St. James, Assiniboine South, where there's an occupational therapist, a registered dietitian, and a social worker. And of course, we're presenting from the downtown Point Douglas team here today. So what does healthy aging mean? There are many things that affect our overall health, and we call these the social determinants of health. Addressing these social determinants of health can lead to healthier lifestyles. So the social determinants of health are a range of factors that influence the health status of people. Now that's very vague, but we'll have a few examples on the next slide here. So addressing these social determinants of health can lead to improvement in our overall health and well-being. So healthy aging can delay and minimize the severity of chronic diseases and disabilities in later life. So having adequate access to nutritious food, stable income, safe housing, and reliable and affordable transportation are some things that contribute to our overall health and well-being. It's never too early or too late to change habits and start new ones. No matter when you start, a healthy lifestyle can make a difference in how you feel and what you can do. So we've got some examples on the next slide here of the social determinants of health. So it'd be like socioeconomic status. So like your income, your education, the amount of stress that you experience in your life. So your early life, like adverse childhood experiences, or what we call for short ACEs. Addiction and different mental health concerns. Food security. So are you able to access healthy foods? Are you able to cook healthy meals? Transportation and other factors about your physical environment related to mobility. So do you have the equipment that you need to make your day-to-day life easier? Your work, or if you're unemployed, or your social exclusion or supports. So that would be, do you have a strong support system? Do you have family or friends? Do you have family that lives somewhere else? So again, what does healthy aging mean? So getting older is a natural part of life. How you'll feel as you get older depends on many things, including what health problems run in your family and the choices you make every day. So if you take good care of your body and learn positive ways to deal with stress now, you can slow down or even prevent problems that often come with getting older. And again, it's never too early or too late to change habits and start new ones. No matter where you start, a healthy lifestyle can make a difference. So some things going backwards here. So being connected to a family doctor, that's really important because that's where you can get your regular checkups, your medications, your prescription renewals, and referrals to specialists. Healthy meals and adequate access to food, exercise, and different social activities. So staying connected with friends and family, your own community, different programs, other social activities, and things to improve memory like puzzles or crosswords, games, making sure that you keep your brain sharp. And environmental safety. So do you have the equipment that can make your day-to-day life easier? For example, you see here, there's a chair for your shower. Do you have, or could you use a walker or a cane, something that could help prevent falls? Okay, so back to the goals of the Healthy Aging Resource Teams. So Healthy Aging Resource Teams have been put in place to support older adults in the community to learn about healthy living and healthy aging and help people live as well and as independent as they can. By doing this and creating healthy habits, it can prevent the need for people going to hospital for medical care. So at HART, we're a client-centered service, meaning that our goals are driven by the people that we work with. So if someone is our client, we will work on the goals that they identify. So we work with you to identify those goals and then support you in the path to reaching those goals. So again, we want to support older adults to achieve and maintain health and wellness. We want to prevent the need for people going to hospital by creating those healthy habits. So if we can get somebody a walker that helps prevent falls in the community, that could hopefully prevent the need for someone going to hospital for potentially a broken bone. And we're here to facilitate a client-centered approach in all services and supports. So the focus of the Healthy Aging Resource Teams, again, we're very client-centered, one-on-one support. So we can come out and do visits in the community, in your home, or we can have clients come to us. We do health promotion and education. So we do presentations like these, information sessions, and health fairs. And we link and collaborate with primary care and service providers to meet clients' needs. So a lot of that looks like connecting with family doctors, pharmacy, housing agencies, and helping our clients navigate through those systems. And again, we assist older adults in navigating the service systems like the health system, income assistance, like EIA, and things such as pension, CPP, and old age security, which is OAS there. Okay. And so the available services at HART, we got that one-on-one support, that health promotion and education, community engagement, And we work with other sectors and agencies, and this can all be individual or in groups. Due to COVID, it has been more individual, like most services or most groups and social activities have been. So the next few slides, we're going to go into a little more depth of these in each of these services. So this one-on-one support, you can speak to a health professional with any questions or concerns, and that health professional will differ by the team. So again, like Downtown Point Douglas team, there's a social worker and a registered nurse. There's chronic disease self-management support. So if you have something like diabetes, one of our clinicians, most likely would be Kathy on this team here, would talk to you about about how to support you with that self-management. We can also assist with system navigation, referrals to different community resources, and self-management guidance. So if someone needs help with EIA to get a budget letter, or they'd like some assistance with getting a food hamper, we can help with that. So we can help connect to resources, problem solve, and link with different community partners. So health promotion and education, we do presentations and workshops on various health and wellness topics. So we do these at apartment blocks or community spaces. We can do some presentations like support groups, or we've done what we call healthy spaces. So we tailor our presentations to the trends and needs identified by the community. Sorry, I'll just get these up on the slide for you. We really do like to be out in the community, and that's something that we've been missing since COVID, but we're very happy to be here today and share some of our information. Okay, and so for community engagement, we like to do special events. I know we've connected with different agencies in our community who have done cooking programs and community gardens. We like to take part in that. Community safety and beautification projects, different walking groups, and special events like these here today. So we don't do this by ourselves. We like to connect with our community and all the different partners here. So that could be like local neighborhood associations, of course, the older adults themselves, different community centers, senior centers, and seniors resource finders. Different access centers, so that could be Access Downtown, Access River East, or Access Fort Garry. So we like to connect with tenant resource coordinators and property managers. So some of these tenant resource coordinators are in buildings, 55 plus buildings, and they help their tenants. And so we connect with them often about doing presentations or helping out certain individuals. We work closely with employment, income, and assistance, as well as the WRHA. As we are a part of the WRHA, we link closely with the community facilitators, the home care program, primary care, so that would be like your family doctor, CWI, which is the Community Wellness Initiative, and various other teams like the mental health team and my health teams. So what is the typical HART client? So there's no such thing. HART provides supports and services based on the priorities outlined by our clients. So I'll give you a few examples here. So we can work with people who have a home care case coordinator or we work with home care case coordinator to help a 73-year-old client avoid eviction by an intimidating landlord. We can help a 58-year-old looking for low-cost eye exams. Or a 57-year-old with multiple presentations to the hospital in a short time. And we can get connected with an occupational therapist asking for an assessment to see what kind of equipment would help them in their home better. So we can help 56-year-olds needing help decluttering their home. A 67-year-old who may be living in a downtown hotel, getting supports from the hotel owner, but the hotel owner's not there anymore. So as you can see, there are many different situations that we can assist with. 67-year-old needs help preparing his suite for pest control treatment. There's quite a few of these, so let me just click through here. Okay.
And I would like to say that all of these are actual clients and actual client situations. So just from these clients, you can see the wide range of things that we can do and how we can help.
Okay, we've got a few more here. So we've got like an 87-year-old who discharged himself from a long-term care facility, so like a personal care home, looking for help finding resources in his new community and how to use his new cell phone. So really, I like to tell people, if you've got a question, give us a call. If we don't know the answer, then we can help you find it. And so how do you get connected to our team? You can call yourself. You can put in a referral for yourself. You can call and ask questions. We'll have our number at the end of this slide as well. You can call with a friend or a family member, or you can have a professional or a community partner refer on your behalf. So this is not a full list, but it could include social work from the hospital, a home care case coordinator, or other community supports. So you can call the Healthy Aging Resource Team. We work Monday to Friday, 8:30 to 4:30. And that's our downtown Point Douglas number. We've got the River East Transcona and St. James Assiniboia South. And of course, you are speaking with the downtown Point Douglas team. And I would like to note that all of our services are offered with privacy and everything is confidential. And again, we are a very client-centered service, so we're not going to do anything that you do not want to do yourself. And yeah, that is the HART team. Kathy, do you have anything else to add?
No, you know what, I think it's important to note that with Taylor had talked about the complement, like the people who are part of the HART team and how the different areas have, occupational therapists or registered dietitians. I think it's important to note that we all work together and we cross collaborate. So if I have a question that is a little bit more for an occupational therapist, I might reach out to the River East HART team and connect with their occupational therapist. Or if I have a question for a dietitian, I would call up the St. James team. So there's a lot of that cross collaboration going on with the different HART teams across the city, because even though we do a lot of similar work, we work in different areas. So being so responsive to the people that we support, our activities are going to be a little bit different. And our backgrounds are different. So we all bring a little bit of a different lens to the table. So I can't help it. I look at things like a nurse because that's what I am. But sometimes I find it very helpful to talk to Taylor because she will see things as a social worker and it's a different way of looking at things. So you will always get kind of a team approach when you're working with the HART program. Now, I don't know if we can see the chat.
Let me see
Oh,
here.
there is a question that came up. So there's a question, are most workers working in office or remote? So this is also something that's not the same across the HART teams. So we had in our River East Transcona HART team, they were able to work from home and work remotely and were actually redeployed through a lot of COVID. Same with our St. James Assiniboine team. But our downtown Point Douglas team, we had a bit of a more difficult time trying to work from home because our clients don't always have a phone or aren't able to access online resources. So we found that being in office worked better for the people that we work with. So once in a while, we might work from home, one of us, but we've been in the office Monday to Friday
Yep.
since COVID started. I don't see the Q&A, Lorena. Oh, hang on. Okay. So we have a question from Izana. What is your opinion upon online dance lessons or sports? Well, we've noticed, and I think all of us have noticed that, the group activities that are so important really aren't possible right now. So although it's not quite the same as having an in-person group that meets for dance lessons or sports, any sort of activity that gets people up and moving and gets you kind of connecting with others, even if it is virtually, can be very helpful at this time. Okay. And the next question is, how would you support a low-income older adult needing a computer and training on using the same? That's what we do. So we regularly connect with resources in the community that offer free or low cost technology. So I think all of the community organizations that we work with recognize that there's a big gap in technology when it comes to our clients and the folks that we serve downtown and in Point Douglas. And primarily that gap is financial, but there is also skills, right? Some of us have grown up with computers and other people, they were introduced to us when we were in our 40s or 50s or 60s. So it can be difficult. So that's something that we assist with. We can help problem solve, navigate if you've got a new phone and you're not quite sure. If you have a tablet and you don't know really how it works, we can do little crash courses and walk you through things and show you how the technology works. And we can also help you connect with programs that that offer this technology at a free or a low cost or a donation program. Okay, so I'm seeing from an anonymous attendee. So what is the difference between the mental health and the other one you mentioned?
I believe that may be speaking about the mental health and possibly the My Health team. So the difference between that is My Health teams are connected to certain family doctor clinics in the city. And so the My Health team has a team of different clinicians. They could also be social workers, occupational therapists, physiotherapists, nurses that see people in the community as well. But you have to be a patient of one of these partnered clinics. And the community mental health program is a program through the WRHA that works with those with diagnosed mental health illnesses. That there's an application process, and if you are accepted into the program, you have a community mental health worker who works with you on a consistent basis to help you reach your goals.
I hope that answered that question. So the next question is, what is the website and contact information, email ID, and telephone number of HARTS? And a follow-up question is HARTS services free of cost? Yes, absolutely. We are part of the Winnipeg Regional Health Authority. All of our services are free. We don't have an official website, unfortunately, even though the HARTS have been around for 16 or 17 years under various names. We still don't have a website. We don't have that online presence. We do a lot of our work over the phone or in person. In terms of email addresses, I would recommend calling us if possible, because we work as a team. So you're not going to, it's a little more difficult to get both of us. But if you call us, then we're able to connect, ask a few questions, and then potentially, whether it's Taylor's expertise that would work better in the situation, or my expertise that would work better, we would be able to determine that from that phone call. And the phone numbers are up on your screen right now. I'm not sure if everyone can see them, so I can type the answer out in the Q&A. I don't know if anybody has called in or if everyone is able to see the screens. So I will take a moment and type the numbers out. And Taylor, the next question is kind of to you. So what skills does a social worker at HART need to have, and how has COVID impacted resources? So I'm going to type out the phone numbers and I'll.
For sure. So I think in a general sense, anyone who is a social worker, some good skills to have um, are interpersonal skills, how to have a conversation with a person, whether that's working for the Healthy Aging Resource Team or whether it's working in a different setting as a social worker. Being able to communicate with your clients and with different partners that you're working with is a very good skill to have, as well as I think the biggest thing that sometimes we may forget about is just the skill of listening, really listening to what the individual wants and helping them to identify their goals. So it's listening to their stories and to what they're telling you. And giving them that safe space to be able to do that. And in terms of resources, COVID has really, really affected resources. There's a lot of resources in the community that had to shut their doors because of COVID. And because they were not providing these services, there was a lot of people calling us saying, hey, how do I access this, which I could have before, but I can't because of COVID. And then there's other resources that have popped up because of COVID. So one example is 311. It is a food security line, which was not present before COVID, but because of the need that our community partners saw, they created this food security line, and that has really, really helped food security during this times of COVID. So where some had to close their doors, there were new resources that have popped up. So both good and a bad sense.
So we have a question in the Q&A and in the chat. I'm going to start with the Q&A section first. So how does someone get support from the program if he has a hearing problem and correspondence is hard? So coincidentally, I just had a meeting this morning with a new HART client who had come to our office looking for supports. And the entire visit, the entire meeting we wrote back and forth. So she's in her 60s and she had never learned sign language. And so this is how she was able to communicate, is by reading what I'm writing and then potentially speaking back or writing back. So that is an option. Unfortunately, we can't guarantee. So when somebody comes to our office, she came to see us last week and we were not able to see her at that time, but we scheduled a meeting for today. So that's a little bit of a concern. So if the person does have hearing problems, if there is a support person in their life that might be able to connect by phone, we would be happy to set up a meeting and then we can come to them, to their home, or we could invite them to our offices and we'd be able to communicate in whatever way works best for that individual. We've also been able to address language barriers where English is someone's second language or they have very basic English language skills. And I have found that Google Translate can be very helpful for those kinds of communications. Technology can be a benefit in that case, and we have had successful interactions with people that have that myself and them, we speak different languages, but we're able to make that connection, and I've been able to help. I hope that answers the question about working with people with hearing problems. Okay, and then the next question that came up was in the chat. So PR, I'm going to guess that is a permanent residence or
Correct.
resident?
Yeah, permanent residents.
Perfect. It's the benefit of permanent resident for an older adult, for senior?
Yes, I think the question is about what's the benefit for them now that they are permanent residents in Canada and they are seniors.
Okay. So if you are over 65 in Canada, I believe as long as you're a permanent resident, you can receive old age security. Let me just, I'm going to double check this in real time. Okay. So you can receive health coverage, and that includes either social assistance if you need support with income, or depending how long you've been in Canada, you can also receive old age security. Old age security is anybody who is 65 or older is eligible for old age security. And that means that you receive payments from the Canadian government once you reach a certain age. The questions are coming in hot and heavy. I'm trying to keep up. Okay, it looks like Lorena answered a question to Maria in the chat. So yes, we would direct you to somebody more specific to make a will. So if you are looking at making a will or an advanced healthcare directive, we have contacts that we would be able to connect you with. And that those contacts do include A&O, of course. A question that came up: for personal safety, one should eat a healthy and balanced diet. I have noticed that most of the people are diabetic everywhere, but there are no food corners for such people available in main food stores in Canada. It is need of the hour that such food corners for diabetic patients be set up in main department stores. I do think it's important for people that have been diagnosed with diabetes to have a way of identifying specific foods that are better for them for their diet. However, it can sometimes be helpful to work with a registered dietitian they can provide a lot. Like, so we have not just registered dietitians, but we also have a certified diabetic educator. And both of those roles, both of those people would be able to assist, so that even if a grocery store you would go into doesn't have this specific section for somebody with diabetes, that you would have that knowledge and information to be able to find foods that work well for you and your specific needs. So this isn't just necessarily for diabetes, people that have heart disease, people that have any sort of irritable bowel syndrome, celiac disease, or Crohn's have very specific dietary needs. And a dietitian can assist with meal planning and planning grocery lists that can help you. Nazar, I do agree that it would be helpful in the grocery store. But I don't know how we'd go about convincing all the grocery stores to have a standardized system like that, because we would be talking about multiple different private organizations that would be doing this. The follow-up question Nazar had was, it would be appreciated if charts of balanced diets are shared by ANO support services and HARTs in due course of time for the benefit of seniors. Absolutely. We do have the most recent seniors, the food guide that was released by Health Canada not long ago. And we would be happy to share that. I suspect ANO likely has that information as well. So those are resources that are available. Okay, so on that note, I'm not skipping questions, but just because we're already talking about diabetes and the diabetic educator, there's a question from Clarita asking for the contact number of the diabetic educator. So our diabetic educator is part of the My Health team. So there is a need to be connected to a clinic that the My Health team works with. However, if you contact our program, we would be able to find the most appropriate resource for you, whether it be a diabetic educator or a registered dietitian that works for you. So even if you're not connected to that specific clinic or to a specific clinic, we can definitely still help you find that resource in the community. We just need to know a little bit more about you. So anybody that is looking for assistance with diabetes education, or assistance with their diet, their nutrition, most definitely give us a call and we'd be happy to help. So how do you support an older adult with a stroke or post-stroke? So I don't know how familiar everyone is with a stroke and what it can do, but in some cases when somebody has a stroke, there are changes to what they're able to do. So it might change the way they walk, it might change the way they speak or the way they eat. It might change their ability to be independent or to work. So depending on what the person is experiencing after their stroke, we can help connect them to more supports in the community. So for example, if a person who has had a stroke is having a hard time walking, we could connect them to an occupational therapist or a physiotherapist that would be able to do a functional assessment and would recommend specific equipment that would make things safer. These occupational and physiotherapists can do these assessments in a person's home and can take a look at the environment and make suggestions as to how to set things up so it works better for that individual patient. If the person is having trouble with speaking after a stroke, we can help connect people to speech language pathologists who would be able to provide additional supports to assist with developing those skills. If it's an independence, like if somebody is needing some assistance with, say, buttoning their shirts or putting on socks, we could connect with home care and request some services that come in on a regular basis to help the person that has had a stroke. So this is a good example of, actually, quite a few of these questions are a good example of how so much of what we do is person centered. So we're very, very focused on getting to know somebody specifically before we connect you to more services. Because somebody that's had a stroke, it doesn't mean like that they're going to have the same effects as the next person, same thing with diabetes, really with any diagnosis. So we want to get to know you, and then we want to help connect you to the most appropriate supports and resources. Okay, there's one more question left in the Q&A.
One last question.
One more. Is there an existing social worker that assists seniors through WRHA as a patient? Would it be possible to get consultation from your program for other services that a senior might be able to use? Yes, absolutely. That's a lot of what our program does, is we connect our clients to other programs in the system, and we can help you navigate. So which basically means if you have if you've called and have tried to connect with a specific program and you're having trouble, we can make those calls on your behalf. If you've tried to connect with specific programs and the process is difficult, the application process, we can help you fill out applications. So that's a lot of what our program does, is we help clients by helping you connect to other programs in the community.
Thank you, Kathy. Taylor, do you have anything to add before we close this presentation?
No, but I just want to thank you guys for allowing us to be here today.
Thank you, Taylor, and thank you, Kathy, for that very informative presentation. And thank you, everyone, for attending day 2 of our Senior Immigrant Safety Expo. And we have our winners. I have Edmundo, Huajang, and Nazar. So thank you, everybody. I will be in touch with you on how you're going to receive your prizes. And don't forget, tomorrow is our last day, our day 3, and we start at 10 o'clock. And our presentation for tomorrow is personal safety or street safety. Thank you, everybody. Bye.